The CDC reports that when it comes to diseases that affect both men and women, colorectal cancer is the second leading cause of cancer-related deaths in the U.S. Joining us this morning is Dr. Mark Hernandez, who's the Chief Medical Officer for Community Care Collaborative, which is a partnership between Ascension, Seton, and Central Health. Thank you so much for being here today with us, Dr. Hernandez. We want to share some important information about this disease. Can you just start by kind of telling us this morning what people need to know about colorectal cancer and what exactly they need to know about the screening for it?
Thanks, Jackie. So, simply put, colorectal cancer screening saves lives. We know that individuals who actually receive their screenings will have much better opportunities to survive colorectal cancer if they get it, and perhaps most importantly, in many cases, we can prevent the disease altogether. What we're looking for are precancerous polyps, small growths in the colon. We can remove them, no cancer. But if we find your cancer early, then we can treat that cancer and your chances of survival are much, much better.
And what are some of the risk factors that some people may face for colorectal cancer?
Sure. So age is perhaps the biggest risk factor. We know that 90% of colorectal cancers are found in individuals aged 50 and older. So this is why we encourage people to start their screening at age 50, and we want them to continue to be screened through the age of 75. Other risk factors include diseases like ulcerative colitis or Crohn's disease, inflammatory bowel diseases. These put you at higher risk for the development of cancer. Family history of a colorectal cancer or polyps puts you in a higher risk class. And then there are lifestyle factors. Colorectal cancer is a very slow growing disease, and so there's the opportunity to modify your risk of developing it. Those things are obesity, alcohol and tobacco use, eating a low fiber diet or eating a high fat diet perhaps can contribute to that, and also the eating of lots of processed foods can also perhaps contribute to the development of this cancer.
I can imagine, but no reason not to get in there and you know, get your colonoscopy. No one looks forward to it, but when your doctor says it's time, it's time. For people who may not be able to afford one, where would the uninsured go for help?
And so that's a great question, because the uninsured in Travis County, which is primarily what my organization helps to take care of, what we find is that only about 1/3 of the individuals who should be being screened are actually being screened. And I think that sometimes they believe colonoscopy is the only way I can do that, and I can't afford that, or I don't know how to get one. The good news is there's a very effective screening test called FIT testing that does not require a colonoscopy. What it requires is a sampling of your stool at home. It gets mailed back or brought back to the clinic, and then we can ascertain whether we actually need to go through colonoscopy. So we have FIT testing in our clinics. But an important and exciting development that we've had is through the Dell Medical School. They have received a $2.3 million grant from the Cancer Prevention and Research Institutes of Texas to essentially increase screening rates in the uninsured population. And so what that department has done in conjunction with partners has created a mail testing program where they basically identify the patients, mail the kits to their homes, and then let them just return them. And so they've mailed out almost 16,000 kits since the beginning of the grant program. And we've received almost 3,000 of those kits back, which is a phenomenal increase in screening. And that has actually resulted in 77 colonoscopies. So those are individuals that perhaps had a polyp or maybe even a cancer that would not have been caught otherwise, but for this program. And so that's been a phenomenal addition.
Saving lives. That's such a wonderful program that people should be taking advantage of in our area. Doctor, thank you so much for being here today. We really appreciate it. Well, here at KXAN, we're committed to helping you learn about your health, along with our partner, the American Heart Association. So for resources and easy tips to live healthier, you can head to KXAN.com and click on Simple Health.